It is Thursday, not Friday, because tomorrow we are closed. So that's why I'm doing my training today instead of tomorrow. And I know this can be a busy weekend for everybody, so I do appreciate you taking the time to join me today to talk about this very important topic, delusions, paranoia, and hallucinations as they apply to those living with dementia. This is a training I've done in the past, but I think it's a great topic to revisit, especially since we have a lot of new people popping in here and there. And a lot of you are taking care of loved ones who have dementia, and a lot of these behaviors can kind of pop up out of nowhere suddenly, and they can be a little scary and they can be kind of hard to understand. And some of them can actually kind of hurt your feelings too. And we'll get into that later, some confabulation and things like that. But I wanted to give this training because I believe that education is a great way for us to cultivate compassion. So when we understand our loved ones and their diagnoses and the behaviors that come along with that, the more likely we are to feel compassion for them, right? And we can strategize on how to help them manage some of these expressions. So this training will probably last about an hour. I'm going to try to get through it quickly, but not rush. But if you have any questions as I go through, please don't hesitate to either unmute. You can just ask me questions in the middle of my talk, or you can enter them into the chat and we can have a little conversation afterward. All of these trainings are recorded and placed on our website. So if you want to go back and watch it again, it'll be there probably next week sometime. And if you have a question and you don't want to be on the recording, that's totally okay too. I'll pause the recording at the end and we can stick around and have a conversation that's a little bit more intimate. So let me go ahead and, first, sorry, I forgot. I have a survey for you at the end of this if you're interested in taking it. Just put your email address in the chat. And this survey is very short. It's just an opportunity for you to give me your feedback. So whether you enjoyed the presentation, didn't enjoy the presentation, or if you have suggestions for future presentations, this is your opportunity to share that information with me. And I promise if you don't like what I have to offer you and you tell me that, it won't hurt my feelings. It just makes me, it gives me an opportunity to grow and become a better presenter for you all. So don't hold back if you have something you want to say, good, bad, and the ugly. I enjoy all of the feedback that I get. So if you're interested in taking that survey, please put your email address in the chat and I'll send that survey to you after our time together today, okay? So let's get into it. Our agenda today, we're going to define some terms. We're going to define dementia, hallucinations, delusions, and paranoia, because sometimes they get kind of mixed together and we're not really sure what those are. So I'm going to define those for you today. And then I'm going to talk about some possible causes of hallucinations and delusions, like UTIs. And we're going to talk about confabulation and why that is a hallmark of dementia diagnoses. And then I'm going to give you some intervention strategies and some resources for you as a caregiver, because we all know that doing this alone is difficult, and doing it with others, with the support of others, makes it a little less so. So I hope you take advantage of those resources when they come to you at the end. All right, so let's go ahead and get into it. What is dementia? So we often think of dementia and Alzheimer's as the same thing. So dementia is an umbrella term under which Alzheimer resides, right? So not everyone with dementia has Alzheimer's, and not everyone but everyone who has Alzheimer's does experience dementia, okay? So really it's just defined as a group of thinking and social symptoms that interfere with your daily functioning. So dementia isn't a specific disease. It is a group of conditions that is characterized by impairment of at least two brain functions, so memory loss and judgment, okay, or speech and things like that. So some of the symptoms, forgetfulness, okay, a lot of people think that's what dementia is. You just don't remember things as well as you used to, but we all know if you've been caring for someone with dementia for any amount of time, you realize that's a lot more than just memory loss. Limited social skills, limited thinking abilities that are so impaired that it interferes with your daily functioning. Okay, so that's just kind of a very general definition of dementia. Okay, so let's define hallucinations versus delusions and paranoia. Okay, so we all know that if you have a dementia diagnosis, there are a lot of changes happening in the brain. Okay, the brain, for whatever reason, whether it's through like vascular dementia that damages the brain cells, or Lewy bodies that, you get those tau tangles in your brain. Whatever the cause of dementia is, essentially it is the deterioration of the brain, okay, the dying off of the brain, okay. And so this, of course, creates a lot of changes in how a person with dementia processes their environment, right? We are all absorbing sensory input, translating that in our brain, and then, reacting in a way that's culturally or personally, whatever, and how we react to that. But when you have dementia, sometimes you don't get all the information, right? Or maybe it's not translated well enough for you. And so this is kind of where the hallucinations and delusions kind of seed is in this space, okay? So with the changes in the brain, people who are living with dementia, they may sometimes experience hallucinations, delusions, and or paranoia, okay? So we might hear those terms delusions and hallucinations used interchangeably, but they're actually pretty different. A hallucination is a false perception of objects or events that are sensory in nature, okay? So that means if you have a hallucination, you're going to see, hear, smell, taste, or even feel something that isn't there, okay? So it's going to engage your five senses in a kind of a disoriented or distorted way, okay? So they might see insects crawling on their hand or hear people talking to them and even respond to those voices, okay? But in contrast, a delusion is defined as a false idea or false belief. And this can sometimes originate in someone just misinterpreting a situation, okay? So for example, if you have someone living with dementia and they have a delusion, they might think that maybe family members are stealing from them, right? Or that the police are following them, okay? So this is a suspicious delusion, and that's sometimes what we refer to as paranoia, okay? The thought that there's a threat somewhere, right? Somebody's after them, someone's watching them, someone's trying to get them, okay? And so delusions are fairly common. It's a very common symptom in dementia, and it'll usually appear in the middle or late stages, okay? So it's not impossible for it to appear in the early stages, but it's usually not as common in those stages. And so while some delusions won't really disrupt the daily life of you or your loved one, others can be especially stressful. Paranoid delusions can be very distressing for both your loved one and for you, right? But it's important to remember that hallucinations and delusions may not be upsetting to the person living with dementia. Not all hallucinations are frightening, and not all delusions are paranoid in nature. Okay, sometimes they may be the result of a person trying to make sense of things. Okay, so an example could be maybe your loved one doesn't remember putting their purse away, and then they conclude that it must have been stolen, right? Because they're making that connection in their brain with distorted or missing information. Okay, so for people with dementia, delusions are typically more common than hallucinations, but both delusions and hallucinations may worsen at night if your loved one is prone to sundowning. And that's just when the sun starts to go down, the symptoms go up, right? So hallucinations affect sensory input, right? Sight, sound, smell, touch, taste. And delusions is a distorted belief, okay? And paranoia is kind of like a flavor of that distortion, okay? Let's see here. So we're going to dive a little bit deeper into hallucinations and some other causes, okay? So dementia hallucinations, they can be relatively harmless or very frightening for people and their with dementia and people taking care of them. So examples of common hallucinations include hearing music or voices, right? Sometimes they'll hear children, laughing, but there's no children in the home, right? Or maybe they'll hear music, right? Who's playing that song, or is the TV on, that kind of thing, and there's nothing going on. Maybe they're seeing bugs that aren't there. Maybe they've seen people or animals that aren't there, okay? Caregivers may observe your loved one with dementia talking to themselves as they attempt to interact with what they're hallucinating, right? So they see somebody in the living room with them, they're having a conversation, there's nobody there, you don't see anybody, but they seem to be having a good time, right? They're socializing, they're having a good time. And for people with Alzheimer's, hallucinations are more common during the middle and later stages of the disease, like I said before, but they can happen for brief periods at any stage, okay? So experiencing hallucinations in the early stages, especially visual hallucinations, is common in people who have Lewy body dementia. Okay, so it's not uncommon for anybody with any kind of dementia to experience these things, but the timeline and the intensity can vary depending on the type of dementia that they have. Okay, so people with vascular dementia can experience hallucinations too. And it's one of the several symptoms that you might notice, which could include delusions, depression, apathy, and the lack of willpower. Okay. So I want to talk about UTIs for a minute because UTI, well, urinary tract infections actually can be one of the more common reasons why people experience hallucinations or delusions. Okay. So a UTI is an infection of the urinary tract, most commonly the bladder. And for most people, key symptoms will include having to urinate frequently or urgently, burning sensation while you're urinating, having unusual color or smell, and sometimes a small amount of blood in the urine might also be visible. But these symptoms are often missing in older adults, and so they're easy to miss, right? And depending on your loved one's capacity for speech, they may not be able to tell you what's going on, right? They're just uncomfortable and they're not having a good time, but they can't tell you why, okay? So they may experience unexplained incontinence, fatigue, or sudden changes in their behavior or mental status. And so it can be kind of hard to diagnose a UTI or to say, hey, these symptoms are due to a UTI because some of the common symptoms that we normally experience, they're not present in the older population. And so it can be kind of tricky. You think, oh, wow, you know, they're going into some kind of psychosis or whatever, and it's really just they'd have a UTI, right? So what causes a UTI? Well, in younger people, it's sometimes related to frequent sexual activity, but in older folks, the changes in personal hygiene are often a factor, right? They're not able to tend to those needs as they used to. And so it can cause problems, especially if your loved one is experiencing like incontinence and things like that. It's a whole different world, right, than what it was when they can maintain their own hygiene. And so that can also contribute to the potential of having a UTI. And so that could be just their cognitive decline or physical limitations like with arthritis or COPD, things like that, can prevent them from being as hygienic as they used to be. Um, so especially like after toileting, keeping yourself clean, things like that can be really difficult for them to do on their own. And you as a caretaker, you know, you're doing the best you can, but sometimes these things just creep up, right? So you play an important role in recognizing any new health issue or symptom that your loved one is experiencing, right? So be on the lookout for some of these UTI symptoms. Some of them are pretty classic and some of them are unusual. So physical symptoms. Of course, they need to go to the bathroom frequently or urgently, okay? But that could be any of us, right? It doesn't mean that alone is going to mean, oh, they have a UTI, okay? But it can be definitely a factor. Maybe they're complaining that it hurts when they urinate or it's just there's a discomfort there. Pain in the lower abdominal area, maybe frequently touching themselves, trying to get comfortable because they're not. Cloudy, dark, or foul smelling urine, new or worsening incontinence, and even fever or chills. Because remember, this is an infection, so your body's going to respond in kind, right? Let's see. UTIs and the effect on mental health. Okay, this is called delirium. Okay, the US Library of Medicine defines delirium as a mental state in which a person is confused, disoriented, and unable to think or remember clearly. And so these are some symptoms that are commonly seen in older adults with UTIs. Of course, they may not all be present and they may fluctuate over time. But again, as a caregiver, just kind of keep these in the back of your mind. And when your loved one maybe starts to have hallucinations or delusions, you can think, okay, maybe they're experiencing UTIs, okay? So a sudden change in any mental status, okay? Confusion, memory loss, trouble concentrating, lethargy, hallucinations, delusions, restlessness or agitation, violent behavior or yelling, changing levels of consciousness. So that could be it's difficult to wake your loved one up, or or sorry, I'm losing my train of thought. It may be difficult to wake them up, but you can still wake them up, right? But if you're having a hard time waking somebody up, obviously you want to consider that maybe a medical emergency, okay, and contact a doctor. But if they're kind of like in and out a little bit, maybe not as disoriented as a medical emergency would imply, but just sorry, the changes are more different than what you're used to seeing in them, okay? And so it can be difficult to notice UTI mental symptoms in someone who's living with dementia or Alzheimer's disease, or if they have existing mental health issues. But the Cleveland Clinic points out that confusion alone does not necessarily indicate the presence of a UTI, but medical attention is still necessary because it could indicate new or worsening health issues. Okay, so we all know that being disoriented, being forgetful, being sleepy, these are common signs of dementia or just being elderly. But again, you are paying attention to your loved one on a daily basis. You know when it's a little squirrely, when it's not what it normally is, right? And where things have shifted. And so it's always a good idea to at least, consider that they may have a UTI and get them to the doctor and see if that's something that they can clear up. And now we're going to talk about delusions. Okay, so delusions, they tend to affect multiple aspects of someone's behavior across a variety of situations. Okay, and paranoia or suspicious delusions, they can be really distressing for you and for your loved one and the family to deal with, right? Because to them, this is the truth, right? This is the conclusion they've drawn, and this is the truth. And to you and everybody else, you realize that that's not the truth. And so it can be very hard to navigate that space and still be respectful and allowing the dignity of that person, right? So delusions are pervasive false beliefs that typically cause seniors living with dementia to believe that they are being followed, they're being imprisoned, stolen from, neglected, wronged, or victimized, often by whoever's the closest to them. And I've talked with many caregivers over the years, and this seems to be one that really triggers that heartache, probably more so than anything else, right? Where you are there caring for somebody, you have their best interest at heart, and yet they're always accusing you of something, right? You won't let me go home, you've trapped me here, you're kidnapping me, you're abusing me, you've stolen from me, right? And that can be really, really hurtful, especially if this is not the person that you remember, right? They never were like this. They were never paranoid. They were never rude or callous, and then all of a sudden they are, right? Very defensive and aggressive. And so when we understand that this is just part of the disease, right? This is part of the symptom of dementia. It might soften the blow a little bit. I'm not going to say it's going to cure it all because words are still words and they still hurt, right? But understanding again can help you cultivate that compassion and realize they're having a hard time. They're not giving you a hard time, right? So delusions among dementia patients are typically a result of the cognitive impairment that they're experiencing, okay? So they occur when someone tries to make sense of a situation, but their confusion and memory problems make it impossible. So they end up filling a hole in a faulty memory with a delusion that makes sense to them, okay? So for example, again, if a loved one can't find their purse, they might conclude that it's missing because someone stole it, okay? And this is a phenomenon called confabulation, and we're going to talk about that next. But I'm going to give you a few examples of delusions that your loved one may experience or something similar, okay? The belief that an imposter has replaced their relative. Okay, this is known as Capgras or Capgras, I'm not sure how to pronounce it, syndrome. And that could be where they're looking at, maybe they've been married to you for 40 years, right? And they're looking at you and they're like, that's not my husband. That's not my wife, right? You're an imposter, okay? Fear that their home is being monitored or invaded by intruders. That's a common delusion. A suspicion that someone stole their valuables. Maybe they insist that their spouse is cheating on them, right? Maybe they have a firm belief that they're younger than they are, right? And that's something that it's a theory of retrogenesis that is coming up where essentially your loved one, as the brain deteriorates, they're kind of going back in time. Okay, so they don't remember being a grandmother, they don't remember being a mother, they don't remember being a spouse, right? To them, maybe they're physically 85 years old, but their memory puts them at 25, right? And so they may have that belief and you can't tell them otherwise. And then that feeling that they need to go home when they're already home, right? And that could just be because their home doesn't seem familiar to them anymore. They don't recognize it. They don't know where the bathrooms are. They don't know where the bedrooms are. They don't know that the front door leads out to the yard. They think it's a closet, right? And so it makes them feel like they aren't home because they don't recognize it. Or if you've moved them from a home that they lived in for 20, 30, 40 years, and they're now living with you in a different space, they may not acknowledge that as their home because in their mind, they never moved in, right? And so these are just some common ones. Of course, there's a bunch of other ones, but those are just some of the more common delusions. So now we're going to talk about confabulation. So what is confabulation? So the neurodegenerative processes that occur and that cause dementia, okay, they have profound effects on somebody's behavior, as you can imagine. Also, their emotions and their ability to think rationally. So typically with dementia, the part of the brain that holds rational and logic thinking goes first. Okay. Now, of course, it depends on the type of dementia your loved one has, but that's usually the most common one. And so it's really difficult to think rationally, and it's even more difficult for you to speak rationally to them, right? To have them see logic, to see them, to see the world the way that you do, because their brains are not operating at the same capacity. Okay. So as the brain incurs damage, it's going to struggle to make sense of the information and the stimuli that it receives, right? And so confabulation is really kind of like a workaround those lapses in memory and cognitive ability. Okay, so they are still receiving input, they're just not able to translate it in the same way that they used to. Okay, so many dementia patients will rely on confabulation to kind of fill in the gaps of their memories, especially when compensating for memory loss in early stages of the disease. Okay, so according to a review article published in the International Journal of Neurology and Neurotherapy, confabulation is the creation of false memories in the absence of intentions of deception. Okay, so although a dementia patient's distorted recollection and memories, even if it's events that never happened, they may seem like blatant lies to you as a caregiver. The truth is that people who confabulate have no recognition that the information being relayed to others is fabricated. Okay, so if they have a memory of something that maybe they saw something on TV, right? But their brain recorded that as a memory, and then they're going to start telling you about this thing that happened that never happened. It might look like to you like they're just making up stories, right? That they're just lying. But remember, their brain is trying to find workarounds in the gaps of their cognitive capacity. Okay, so let's say, for instance, your loved one is watching the news, right? And they see somebody on the news who was robbed, right? They may then, for some reason, internalize that as a memory that they experienced, not a story that they watched. Okay, so then they might start telling you about how they were robbed and it never happened. Okay, that's just an example. Which is also a good idea too, to be very careful about what you allow your loved one to watch. Because if it's something that's kind of troubling or violent, things like that, it can kind of actually cause them to be a little off. Okay. So, do dementia patients lie? Okay, so when a person develops any form of dementia, it is difficult for family and friends to witness that diminishing capacity, right? And all the frustration that that brings. One of the worst things that you must cope with as a caregiver of someone with dementia is the fact that your loved one's brain is sick, right? It's kind of broken, and it might cause them to tell lies, quote unquote, about you or other people in your space. Okay. So this damage can cause them to make up hurtful stories and even accuse you falsely of things that you've never dreamed of doing, could never even do, right? No matter how far-fetched these untruths and accusations might be, your loved one believes that they're true. Okay. And as much as they hurt, it's important to remember that there's really no ill intent. Okay. This disease is causing your loved one to fabricate stories. Okay. So emotions like anger, anxiety, confusion, that can leave your loved one feeling vulnerable and taken advantage of, right? And that can cause them to be defensive, right? Or accusatory. They're trying to make sense of what they can't understand, what they can't remember, okay? Misplacing or hiding personal items, that is a hallmark of dementia, and that can be really disorienting and frustrating for you and your loved one, right? Especially if you add in a little bit of paranoia and delusional thinking, right? Something that's lost, like medication or a sweater or a purse or a wallet, right? It can suddenly spur your loved one into this, this false accusation of theft, right? Of you or somebody coming in your space. And so, unfortunately, there are a lot of instances where people have taken advantage of someone with diminished mental capacity. But when dealing with cognitive changes in dementia, it's far more likely that helpful and well meaning gestures are misconstrued as acts of trickery or deceit. Okay. So, here's an example. Someone who has dementia may ask you or a family member to take a piece of their clothing to the dry cleaner, right? Or repair their eyeglasses, right? Or purchase groceries with cash that they've given you, okay? And when they find that their favorite blouse or their glasses or their money is gone, they don't remember that they requested for you to take care of that, right? And so they're going to misconstrue that information and they can accuse you, right, of stealing, of being dishonest, right? And of course, that's going to leave you to feel like you have to explain yourself and you're telling someone, no, you gave this to me to take to the dry cleaner, or you gave me this to go buy groceries for you, right? But they don't remember telling you that. They just know what they had is gone, right? And so it's really difficult when you're trying to explain yourself to somebody who really has lost their capacity to reason with you. Okay. So again, you might feel the need to defend yourself and explain yourself. No, remember, you gave me this, right? But you cannot ask a person with dementia to remember something. They typically will not be able to remember that. So there's strategies that you can work around that. I did a training not too long ago called Communication and Dementia, and it addresses this and how you can de-escalate these situations. And so I encourage you to go back and watch that. Because it really is just about distraction, right? Validating their concern, not admitting to doing something wrong, right? But validating their concern and then using a distraction technique, okay? Because if you sit and argue with them, guess what? You're just going to activate that amygdala and you and them, and then they're going to be mad all day and they won't even remember why they're mad. They're just going to know you're mad, so I'm mad, okay? So the best course of action is to not argue with somebody who's experiencing confabulation, okay? Okay, so now we're going to talk about dementia, delusions, and false accusations of elder abuse. Okay, so we all know that this world is not full of sugar drops and honeycombs, right? That there are people out there who take advantage of people who are ill and elderly. We know that, okay? But more likely than not, if an accusation of elder abuse comes up, it could be a result of these delusions or this confabulation. Okay. So most false accusations stem from somebody's inability to connect with reality. Okay. So, for example, if you're trying to help somebody with bathing or dressing, this may be misconstrued as inappropriate touching. Okay. Again, they might not remember that they need assistance, right? They might not remember who you are, and they might think you're just a stranger trying to take their clothes off, okay? Which can be very very disheartening for somebody, right? Or trying to get somebody in the car to go to an outing or a doctor's appointment, they may translate that to kidnapping, right? They don't know who you are. They don't know where they're going. They just know you're trying to get them in a car, and that can be very scary, okay? So the way that they perceive the world around them has changed, and the reaction is often one of fear, suspicion, self-protection. Okay. So remember that when it comes to making up stories, people with dementia, they're not intentionally causing trouble. Okay. So, of course, if you have a loved one who has a history around compulsive lying or malingering or being manipulative, it is likely that their fabricated stories um, can still be part of their cognitive decline. Okay, so say you have somebody that you're taking care of who maybe before the dementia diagnosis, they were kind of manipulative, they did make up stories, they did lie about people, right? That could still very well be what's going on, right, in this space, because they're still who they are even if they have dementia. But oftentimes it's not due to a personality trait or characteristic. in dementia, especially in the later and mid stages, it is that confabulation, that delusion that happens because they're missing information. Okay. So dementia caregivers, you got to remember that the outrageous things your loved ones say, that is the disease talking. Okay. It's not their old selves. And try to your best to keep your sense of humor even during the most trying times. Okay. So dad may be livid and screaming about you stealing his dentures, but if you think about it, the concept of stealing someone's dentures is kind of funny, right? Like, why would you do that? Like, what are you going to use them for, right? Um, and there is some truth to laughter being the best medicine, right? Of course, you can't laugh in someone's face when they're obviously distraught, but I mean, you can to yourself be like, well, this is really ridiculous, and I'm not going to take this personally, okay? And that may come with a lot of trial and error and practice on your part. You're probably not just going to immediately be in this joyous space of finding humor in, the horrible, but over time, you may develop that skill set, and it could serve you well, okay? Many caregivers often find that if they didn't laugh about the situation they're in, they'd end up crying instead, right? And I think that's true for most of us. But just keep in mind that these times where they're accusing you, right, when they're in these delusions, when they're in this confabulation, this doesn't last forever. Okay, this is kind of transient, and they will forget that the incident even happened, right? What are they even reacting to? They'll forget, but you won't forget, right? And it's really hard when you remember being accused of stealing or hurting somebody that you love, right? But again, this is where you can offer yourself some self-compassion, right? And realize this is somebody who's sick. They are not trying to hurt my feelings. They don't remember this exchange that just took place 20 minutes ago, but it's still kind of being harbored in your heart. Those are the times where you kind of turn to yourself and give yourself some self-compassion, right? Yes, this is hard. Yes, this hurts. Yes, this isn't fair, but it's not my fault and it's not their fault. It's the disease. Okay. And maybe you can find some comfort in that. Okay. A great amount of tolerance and patience obviously is needed in dementia care. Confabulation, paranoia, delusions, all of these behaviors, they are brought on by the disease, right? It's not your person that you love trying to go out of their way to hurt you, okay? But of course, there are times, unfortunately, that you have to protect yourselves and document your efforts to care for the person you love, right? So that way, if an accusation should turn into more than just a fleeting outburst, um, seek proper help and guidance, right? Make sure that you can remain blameless and continue providing care for yourself or your loved ones, okay? So keeping a journal of moments like this can be helpful if and when the time comes where you have to defend yourself, okay? I know I've talked with some caregivers and they're like, well, my loved one called the police on me because they thought I was an intruder, or they thought I was trying to take them, or they thought I was, they found a bruise on them and, because they bumped it into something they don't remember and they assume that I gave it to them, right? And so it can be, depending on the intensity of your loved one's expression, it may be worthwhile for you just to kind of keep track of those moments so that you have something to kind of share with others if it's necessary. So what are some intervention strategies? It can be really a struggle to adapt to your loved one's decline, right? Their physical decline, cognitive decline, emotional changes, right? It seems like as soon as you get it figured out, something changes and you have to start all over again, right? Um, Even if you've learned about the proper ways to respond to hallucinations or delusions, it can still take a lot of patience and practice to see it through, right? And having to repeatedly step into your loved one's alternate reality, that gets really, really exhausting. Okay. But recognizing the cause of these dementia related behaviors and understanding what your loved one is going through while they endure hallucinations and delusions, that can help you remain calm and find solutions. Okay. And um, it's very common. It's kind of a reflexive thing that we have when somebody accuses us of something to defend ourselves, right? We want to say, no, that didn't happen. That's not me. Why would you think that, right? But a defensive posture will never de-escalate the situation, okay? And I'm not saying you have to admit that, yes, you did steal something, okay? Again, we try to pivot, we try to distract, okay? So as a caregiver, witnessing your loved one hallucinate or be in delusion, that can be really troubling and probably more troubling than some of the other dementia related changes that they experience, right? Um, Maybe you've noticed your loved one talking to people who aren't there or showing aggression towards you during these episodes. And of course, more than likely, your first instinct is to help by convincing them that what they're experiencing isn't real. Okay. Um, and this might seem like a very logical approach to us, but experts say that it can backfire. Okay. Because again, remember, they're not aware that they're in a delusion, right? So it's kind of like if you were to say, the sky is blue and everyone around you says, no, it's brown, right? But you're looking at the sky and it's absolutely blue, right? How frustrating would that be if everyone kept telling you, no, it's brown, no, it's brown, no, it's brown, okay? They're in this space, they're in this reality as their reality. Okay, so if you keep trying to tell them that they're wrong and they're delusional and they're hallucinating, right? That's just going to escalate things. Okay, so we can go to the doctor in this space. Okay, if your loved one is experiencing hallucinations or delusions, the best way to start is by arranging the consultation with their doctor. Okay, again, they can look for physical causes like a kidney or bladder infection, right? Those UTIs, dehydration. Maybe they're taking pain medication or using alcohol and it's having a weird reaction in their body, right? That can cause hallucinations and delusions. Um, if your loved one is taking a prescription that is giving them these symptoms, talk with your doctor, report those side effects, right? Anything that you've noticed. So, like over sedation, right? If they just really having a hard time staying awake. If their confusion has increased since taking that medication, do they have tremors or tics that happen since start taking that medication, right? So this can definitely be managed if the medication is causing hallucinations, delusions. Tell your doctor about it, tell their doctor about it, and they may be able to switch doses or switch medications, okay? And it's probably going to be incredibly helpful for you to make sure that your loved one is, using their hearing aids if they have them. Make sure they have the batteries that they need in there. Make sure they're wearing glasses, right? Because a lot of times, again, that sensory input is jarbled, right? It's not coming to them clearly. And so if you add on top of that, poor eyesight and poor hearing, it's going to be even more difficult for them to be able to determine what sensory input means when it comes to them. Okay. So make sure you're checking that regularly. Make sure they're going to the eye doctor and all that stuff. Okay. There are non-medical interventions. Okay. So these are often the best way to help someone who's experiencing hallucinations or delusions. Assess the situation and determine whether the symptom is a problem for you or the individual, right? So, is the hallucination or delusion upsetting to the person? Is it leading them to do something dangerous? Does the sight of an unfamiliar face cause them to become frightened? If so, just be calm and react quickly with reassuring words or comforting touch, okay? So we assess the situation. So how are they responding to the hallucinations or delusions, right? If they're not causing a problem for the person, then it's probably best to just ignore it, okay? If they're seeing a cat and it's not really there, but they're having a great time watching that cat, let them watch the cat, okay? Don't argue, Mom, there's no cat, right? What's that going to do? It's just going to upset her, right? And upset you in the long run, okay? You don't want to argue with someone about what they see or hear or believe. It's natural to want to correct them, but unless it's a dangerous behavior or it's upsetting to them or frightening to them, you don't need to intervene. Okay, just let it be what it is. Next, offer reassurance. So reassure them with kind words and gentle touch if that's something that they respond well to. So you could just say something simple as, don't worry, I'm here, I'll protect you, I'll take care of you. I know you're worried. Would you like me to hold your hand, right? Would you like me to walk with you for a while, right? Just to be that calming space so that they can regulate with you, okay? Gentle patting or, touching can turn their attention toward you and away from whatever is freaking them out, right? And it can reduce that symptom. You can also look for reasons or feelings behind the hallucination or delusion, right? Try to find out what it means to them. So, for example, you might want to respond with, it sounds like you're worried, or I know this is frightening for you, okay? And then using distraction and redirection, okay? So this is a strategy that you can use, and it may not work for every person or false belief, right? If you got somebody calling the police thinking you're trying to kidnap them, they may not respond to gentle pats, right? But if a loved one is experiencing a mild delusion, You can offer them a favorite snack or an activity, right? And that could be enough to shift their attention. A lot of times they respond really well to pleasurable sensory information, right? So they might think something terrible is happening, right? But you can say, well, let's go get some ice cream, or, let's watch this, cat video or what have you, right? Something that they're going to enjoy, and that can distract them. Because typically, especially in the mid to late stages, they are going to be able to focus on one thing at a time, right? So if they're focusing on something that's pleasurable to them, they're going to forget all about what was upsetting them before. Okay. So redirection is a really great strategy. Maybe you can suggest that they go on a walk with you, or go into another room, right? Um, Often frightening hallucinations and delusions will subside if they're in a well-lit area with other people present. Okay. So if you're in a space where there's not a lot of lighting, there could be a lot of shadows, right? And so they're taking this visual stimulation in, and they're translating it in their brain as maybe, somebody hanging out in the corner, right? And there's nobody in there, but the shadow might make it look like there is. And so they're going to freak out that there's a stranger in their house, right? But you move them into like the kitchen where there's maybe more light, more people, then they're not going to see those spooky shadows as much, right? Open the curtains, that kind of thing. Okay. So you might also try to turn their attention to listening to music, drawing, looking at photo albums, or even like counting coins, right? Just something that is very tactile that can get them distracted. Okay. You can be creative, what works best for your loved one. Responding honestly. So keep in mind that they may sometimes ask you about a hallucination or delusions they're experiencing, right? So they might say, like, hey, do you see him? Do you see that cat? Do you see that kid? Right? And you can answer with, I know you see something, but I don't see it. Okay. So that way you're not denying what they see or hear, but you're avoiding getting involved in an argument. Okay. And it helps to normalize their experience. Now, this may not work for everybody. They say, do you see that person? And you say, I don't see that person, but I know you see it. Depending on their personality, they might think you're trying to be sassy, right? Who knows? So you know your loved one better than anybody else. So you can just be kind and gentle when you respond. You can be honest when you respond, but you don't have to argue with them, okay? Again, modifying the environment, right? Removing triggers, right? Or removing a person from a triggering environment, okay, where it's overstimulating. That can help reduce hallucinations. So triggers could be, again, lighting that casts shadows, sounds that could be misinterpreted, like the TV, right? Maybe there's a bunch of hullabaloo going on the TV, gunshots, or people yelling and arguing, and your loved one thinks it's, happening somewhere in the house, and they start to get scared, right? Maybe there's mirrors that cause them to think that they're seeing a stranger instead of their own reflection, right? That's something that's not uncommon, where they can look at themselves in the mirror and think, who is that person? And think it's a stranger. Maybe they're looking at kitchen curtains and see a face, right? Then maybe you can just remove those curtains or open them up, right? So that it just kind of shifts the shadow a little bit for them. Turning on more lights to reduce shadows, that could be frightening. And if the person has delusions about people stealing for them, have some duplicates on hand, right? So if they say, someone stole my glasses, oh no, here they are, it's just another pair, right? Someone stole my remote, oh no, here it is, it's right here, okay? And of course, as you move through this space, you're gonna start, you're gonna pick up on what the most common thing is that they lose or misplace and accuse you of stealing, and then you can just, plan accordingly. And then medications. So we always advocate for non-drug interventions as much as we can, right? And they're usually very effective. However, medications can be helpful in some cases if your loved one is persistently upset, right? If their symptoms or if they're upset by the symptoms and non-drug interventions have already been tried and they're not doing it for you, okay? You might want to ask the doctor to evaluate and determine if the medications need to be added or adjusted or reduced to kind of tackle these delusions and hallucinations they're experiencing. If your loved one has a history of a serious mental illness, such as schizophrenia, these hallucinations and delusions may be related to that illness, right? It may just be compounded by the dementia diagnosis. So it's very important to work closely with their doctor and determine the appropriate course of action. Okay, there are strategies you can do that are non-medical, but there are medical options available as well. Next, Do nothing. Sometimes that's okay, right? Sometimes hallucinations, like seeing children or hearing music, that can be comforting to your loved one, right? And so if they're reassured by what they're experiencing, don't feel compelled to stop it. It's not hurting them, it's not hurting you, okay? Um, Next one, easier said than done. Don't take it personally, right? Delusions can be frightening for everyone involved, including your loved one who's having the delusion, right? Um, but they can also be very hurtful when you are the target, right? But recognize that your loved one is living in a world that doesn't make sense to them and that they're probably scared, right? Even though you are often going to be the anchor that they need to ground them in reality and calm them, you can also be the source of their accusation, right? Or the thing that they're pinning their accusations on. So it's a very complex space to be in where they want you for comfort, but they also accuse you of horrible things. And it's kind of like, well, what do you do in that space, right? So it's hard. Okay. Try not to take it personally. Acknowledge how hard it is. Reach out to somebody who maybe is experiencing something similar or has walked this journey as well, because it's not easy. Okay. Next, you can support your loved one, right? Reassure them and avoid asking questions that might confuse them further, right? If they're looking for an item, just tell them you'll help them find it, right? I'll help you look. And then try to avoid offering explanations, okay? So if you try to convince your loved one that what they're experiencing isn't real, that's likely going to lead to agitation, right? So try to take the opportunity to make them feel loved and reassured and that you're there to support them, okay? So now we get to talk about self-care, right? Because this is hard stuff. It's not fun and it can be very hurtful and distressing. So self-care is a key component to making this sustainable for you and your loved one, okay? It takes a lot of time and effort, and it becomes harder when your loved one gets angry with you, when they hurt your feelings, when they forget who you are, right? And this may leave you feeling discouraged sometimes, sad and lonely, frustrated, confused, angry, right? All of these feelings are normal. All right. So don't beat yourself up for feeling frustrated, confused, angry, hurt, or discouraged. Okay. So here's some things that you can say to yourself that might help you feel better, right? I love a positive affirmation, and they really do help when you're in those moments. And if you have a hard time showing yourself self-compassion, just saying some simple things like this can be a great place to start, okay? You say things like, I'm doing the best that I can. What I'm doing would be hard for anyone. It's okay if I'm not perfect, right? You can't control everything that happens. Sometimes you just need to do what works for right now, right? That can be hard, especially if you got like little bits of perfectionism in you, right? To just be good enough and not perfect can be really hard. Um, Try to get help from a counselor if caregiving becomes too much for me, right? And I do want to say that sometimes we shy away from getting professional help because we think, well, I can do this on my own. I can manage this on my own. I just need to get over it. I need to toughen up, right? And that could be very true, right? Um, but it doesn't hurt to get a little bit of help at the same time, right? So you are strong, you are capable, you are competent, but this is still increasingly hard, right? It doesn't get easier, okay? So you may have been okay in the beginning managing things on your own, but as the disease progresses, as the symptoms increase, as the workload becomes more heavy, that wears on you over time, okay? So don't be afraid to reach out. You can reach out to me, right? I'm a licensed social worker. I can help that kind of stuff. We have a therapist on staff who offers free therapy services to you or your loved one. So if you need that, please reach out. Mental health professionals and social workers can help you deal with stress and the way that you're feeling, right? We can help you understand feelings like anger and sadness or feeling out of control, right? We can help you make plans for unexpected or sudden events that happen, right? It's just a professional who has been trained to help guide you through this can be a great resource for you, okay? So other things to keep in mind as you take care of yourself. Understand that you may feel powerless and hopeless about what's happening to the person that you're caring for. Okay. That's not a flaw in you. Okay. Because really, you are powerless in a lot of ways, right? You can manage, you can help cope, but you can't control, right? You can't control what's happening. And so there is some powerlessness in there, okay? And that's not uncommon, okay? You may feel a sense of loss and sadness, okay? Because even though there's a lot of joy to be found in a caregiver space, there's a lot of shifting that has to happen, right? A lot of things you have to let go and a lot of things you have to pick up. And so there can be that sense of loss and sadness. It doesn't mean that you don't love your loved one or that you aren't happy to be the one to care for them. But to deny that you're experiencing loss and sadness is just going to compound the issues that you have. So understanding that you feel that and that it's common can be really liberating for you, okay? And let yourself feel those day-to-day uplifts. I think the term that they're using now are glimmers, right? Little things that shimmer throughout the day that bring you joy. So maybe even just good feelings about the person you're caring for, support from other people, or time spent on hobbies and your own interests can really go a long way to decompressing that pressure cooker that you're in. So very quickly, I'm going to give you some resources. And of course, these slides will be available on our website. And if you want me to send these to you, I'm more than happy to just copy and paste them into an email for you if you want to explore them at your leisure. So there's a lot of resources available to you as an Alzheimer's or dementia caregiver. One of them is the Alzheimer's and Related Dementias Education and Referral Center. And so this offers information and free print publications about dementia to family caregivers, health professionals, okay? They also have telephone, email, and written requests that they'll answer and make referrals to local and national resources, okay? So if you're just getting on this journey or if you've been in it for a while, but you've been doing it on your own and you want some support, this is a great website to go to, or you can call the phone number on the screen and they can help direct you to local resources. Of course, alzheimers.gov, your loved one doesn't have to have Alzheimer's to find resources on this page that can be useful to you, okay? There's a lot of information and resources for Alzheimer's and related dementias from across the federal government, okay? So these are going to be studied, peer-reviewed kind of things, okay? Next, the Family Caregiver Alliance. You can call them or email them or go to their website, and they have a lot of space there for you to connect with other caregivers and some great resources and tips for you. Elder care locators. So you want to have a place to take mom or dad or your husband or wife or your loved one that you're caring for, just to give you that break, to give you that respite. Okay, so you can call this number, go to this website, or email them, and they can direct you. Same with the National Alliance for Caregiving and the National Respite Locator Service. Okay, so there's a lot going on in the community, a lot going on nationally for assistance for you. And then my last resource for you is the 24/7 helpline. You can call this number if you want to talk with somebody who has experience, whether it's lived experience or professional experience with people who have dementia or Alzheimer's. You can talk with them. And it's kind of like what we call a warm line. It's like a hotline would be like an emergency, right? And a 988 or a 911, right? But a warm line is where you can call where it's not an emergency, nobody's in physical danger, but you maybe need some help. You need somebody to talk you through a situation you're in, okay? So you can call that number. It's free and it's confidential. And the same with the Alzheimer's Association 24/7 helpline, okay? So you can get advice and support from their trained staff. They can also help you with referrals and community programs and services, education, crisis assistance, and just emotional support, okay? Sometimes it just helps to have somebody say, I get it, right? You're not crazy because you feel this way, right? That can be, you know, a world of change for us. And so these are going to be master's level clinicians, okay, therapists, counselors, social workers, and they can offer care consultation, okay? And they also have interpreter services as well. So if English isn't your first language and you have another one that you want to use, they can accommodate you, and they can also do the TRS. So if you have hearing difficulties, they can still communicate with you over the phone. So that's my info for you today. I'll go ahead and stop my share and pause the recording.